Fantastic. Brilliant. Thank you everyone for joining the third of our webinars. For those of you who haven't been on the previous ones, in surgery and cancer, we've been very keen to set up a way where we can keep working together, keep communicating together and look after each other in these unprecedented times. So we started before Easter with a question and answer session with Professor George Hanna leading, and we were delighted with how that was received, so decided to carry on with them on a weekly basis. Last week we had the first of our scientific webinars set up by Amanda Cross, where we helped build some new collaborations that could happen even in these lockdown periods. But today we're doing the first of our wellbeing webinars, dealing with the idea about how we can maintain mental and physical health whilst our working patterns are completely different to anything we've ever had before, and the stresses that we're all undergoing are completely different to what we've had before. So we were very pleased to get some excellent speakers for this, and then we decided to open it out to the wider Faculty of Medicine. So welcome to all of those from the other departments who are interested in this event. We will be recording the event and making it available on our website. So if you think it's useful and want to advertise it to any other members of your team, please feel free to do this. So we divided the session into two. The first session is going to be on mental health, and I'm delighted to welcome Claire Fox, who's acting head of student counselling and mental health advice service for Imperial College, to deliver this half. We're going to have time for questions built into this, and you'll notice on your Teams there will be a question panel that you can bring up. If you move your mouse and click on a little speech bubble with a question mark, you can type in a question and then I will ask these for you at the end of this session. And then after this, we're going to move on to a session on physical well-being, led by Leisha Wegg and Gary McDermott. So I'll now hand over to Claire, and as I said, please ask questions. Anything in particular that you're worried about, put it on the question thing and we can include that in our discussion afterwards. Okay, thank you.
Thank you. I'll take over and hopefully this will, okay, yeah, hopefully everybody can see the PowerPoint presentation that is up. My name is Claire Fox and I'm the acting head of student counselling and mental health advice service at Imperial College London, and the clinical lead for counselling. Been at Imperial for 3.5 years. And I'm a psychotherapist and I'm an EMDR therapist, so I specialise in trauma and sexualised trauma in particular. In terms of where I wanted to position this, this is a vast subject, as you know. I could talk, we could have a whole day's workshop on this subject, but I want to try and keep it as informal as I can, and try and throw in a couple of hopefully fun coping strategy exercises, which we'll all do together, and I'll lead on those, and leave it open for you guys to ask some questions as well. So I've entitled it Dealing with Isolation During COVID-19. I'm trying to position it in terms of you as staff members, how you might be coping with it yourselves as kind of members of staff, but also thinking about the students you support as well. So hopefully, let's see if we can move this. I'm just trying to actually navigate forward, and actually I can't even navigate to my second slide at the moment. I'm wondering if Benji, you could, there we are. Okay, it seems to be working. So what we're going to be looking at now is we'll be looking at our human responses to the pandemic. I'm going to be covering coping strategies and points to consider for support. So in terms of our human responses to where we are at the moment, the way that I think about it as a psychotherapist is we're in a period of huge change and influx. I keep on hearing the words, we're in uncharted territories, this is all new. And I suppose the way that I think about it is change is inevitable. It can be frightening for sure. And we need to remember that the feelings of anxiety and fear, even though they might feel endless at the time, ultimately they will end and we will come through this. I imagine that in terms of the student cohort at Imperial, we would have a huge spike in referrals and students coming to us with huge health anxiety around what's going on at the moment in the world. And actually what I've noticed, and it's a UK picture across UK universities, I'm hearing from my colleagues that there isn't indeed a spike with health anxiety from students. I mean, we are seeing that daily, but there isn't the spike that I would imagine that might happen. So that's reassuring. I also had imagined that maybe 5 weeks into the quarantine, I would see again a spike with students and staff's anxieties being more heightened. But again, that hasn't happened so far. So I don't know if that's reassuring to you or not, but I wanted to kind of give you that overall picture. So if we look at kind of where we're all at with where we are at the moment, for sure there's a lot of, let me see if I can move forward. Yeah, there's a lot of health anxiety. Along with that, there's spikes of kind of stress and depression. I'm going to come back and talk about that first point in a minute, but I just want to kind of flag up what I'm noticing that we all might be feeling or going through. There's certainly a real sense of loss at the moment. So you all know that the cycle of bereavement, it's certainly something that we might be feeling individually, but something I'm seeing within the students at the moment, that we're feeling the loss of routine, the loss of structure, the loss of what we really knew to be true about our daily lives. And so that brings up thoughts and feelings around a real loss. And what we need to keep ourselves feeling safe and secure and okay is structure. As boring as that might seem and sound, and in my early 20s, I might have thought that I wanted to be spontaneous and free. Certainly now, at the age I am now, it's all about kind of routine and structure and safety. And as human beings, we need that, we crave that. So being very much aware that the loss cycle will be felt within all of us. And what I'm then noticing is that really is making us all as human beings question our view of life and what we knew to be true, and it's getting us to readdress and reassess our relationships, our jobs, once we come back out of this quarantining and maybe back to our, physically back on campus, what that means for us. And so I think all of us, and it's healthy to be questioning, did I get the work-life balance right? Did I not? And all of us as human beings will be thinking about that, and that's healthy, and that's good to ponder, good to think, and good to kind of readdress that work-life balance. What I'm noticing with both those two things within the student cohort is a lot of students are quarantining at home in unhealthy relationships with unsupportive people around them. So for the minority and for some of the students you will be supporting, there is a real sense of hopelessness at the moment because the people that maybe they had surrounded themselves with, they're no longer with. And so it doesn't feel a very safe environment for them. So that is something to be mindful of, or you yourselves may be more restricted at home, feeling like, goodness, getting out and having my daily job outside of the home felt really refreshing. Now I'm back and I'm in a very unhealthy cycle here, or with unsupportive people around me. So I think this is something that we need to be considering. There's something around the parallel process with those we support. And what I mean by that is we're all in this kind of situation with what's going on in the world together, along with students and staff. So the people we might be supporting, either the people we're managing. I know I manage a team of 22 people, and me as a manager versus me as a therapist, we are all in this together. So the feelings of our anxiety being spiked, or the feelings of loss, or the feelings of us questioning where we are at the moment in life, is being felt by the people we manage and by the students we're supporting. So we need to be mindful that there is a parallel process going on, and that our stuff doesn't tip into either the people we're managing, it doesn't become their anxiety, or it's not the students' anxiety. And to bear in mind what I said at the start, which is we're not seeing overall the spike in student anxiety rising because of this. So I think that's important to kind of ground ourselves in that reality. What I want to kind of focus on is kind of coping strategies. Let's try and make this practical. So that all leads into trying to think about this health anxiety, that maybe a little bit of the depression that might be going on at the moment, spikes in stress, is trying to normalize feelings and normalize where we're at. So I think the thing is, we are all pattern seeking kind of creatures. It's how we navigate risk. It's how we keep ourselves safe in the world. And so what I'm saying to myself, my staff at the moment, and to students is the phrase, which is really helpful: what do I know to be true today? And I was supporting a student that's overseas at the moment this morning, and I was saying to him, you know, as his anxiety around health is spiking, I said to him, okay, ground yourself in the reality. What do you know to be true today? Because the brain will feed on fantasy and fiction to get the fix of the anxiety and skew our perception of the world and make it worse than it is. So that kind of escalation of anxiety, we have to be really careful and ground ourselves in reality. So it's all about reframing the reality. So rather than catastrophizing thoughts. So what I'm going to encourage you all to do, if you can kind of have any sort of, you think, yeah, that is me. Sometimes I've noticed during this whole kind of quarantining that has been part of my cycle. What I have been doing is think about your cycle of awareness. So try and catch yourself in the act of either thinking negatively, of catastrophizing something. And when you feel that, and you can catch those thoughts, those cognitions, or you catch within your body, sometimes we don't have the cognitions, we have the body sense. So the body feels stressed, or you feel it in your chest, or you feel your breathing just escalate up a little bit. Catch yourself in the act, catch the negative thought, catch the kind of what's going on, and say to yourself, what do I know to be true right now about the world, about the situation, about myself, about my life? And try and ground yourself in some positive reality and breathe. Because what's actually going on here is the flight or fight. I mean, for me, I think about flight, fight, freeze, flop. It's the whole kind of reactions to this kind of health anxiety and what's going on at the moment. So we need to remember that we tend to react to things that we can't analyze and predict, and that creates the anxiety, and that's normal. It's normal for us to feel anxious at the moment. It's normal for us to feel a little bit low at the moment. So with the hypervigilance, the spikes in anxiety, and the kind of the adrenaline and the cortisol that's going to be producing within the body, it's trying to burn that off and kind of get rid of that as quickly as possible. So I'm going to take you through a really quick exercise if you can do this. I mean, the problem is I can't see anybody apart from Chris. So hopefully Chris will be doing this, but I'm going to do this with you if you can see me. It's something I do with students, something I do myself. So when the body goes into that kind of more hypervigilant flight or fight response, and we might have a negative or an anxious thought that comes through, the body will produce adrenaline. And the ideal would be to go run it off, because it burns adrenaline out of the system. Sometimes we can't do that. So a really good way of burning that adrenaline out of the system is to do what I'm going to do now. So very simply, if you're sitting down, even if you're lying down, you can do this, but let's do it sitting down together. So what I want you to do is we're going to over-exaggerate the tension in the body to basically bring the tension down. So we're going to start with your core. So core muscles, suck those in. So like hold them right in. Still breathe as you're doing this. And at the same time, clench your buttocks up, hold your core in. And at the same time as doing all of this, I want you to push your feet down into the ground. Maybe you want to hold onto the chair, and the trick is not to push the chair backwards. I don't want any chairs being lifted off the ground and people hurting themselves, but literally push the feet down into the ground, clench your buttocks up, hold your core in, and imagine that your thigh muscles and your calves and your legs are really feeling tight, 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 and you're holding that in. If your legs are shaking slightly, you're doing it well. If they're not, you need to be going harder at this, okay? So at the same time breathing, hold that in, count to 5. So 1, 2, 3, 4, 5, and let go. You should get a nice sort of come down feeling. If you're getting that, you're doing it right. If not, next time you need to be doing it a little bit more, kind of going for it a little bit more. Now we're going to work the way up the body. So obviously the body might, let's imagine the body's quite stressed, there's a lot of adrenaline being produced, so we're trying to burn it off. And when you actually clench the muscles tight, the adrenaline tends to go to those large muscle groups and get burnt off. So we're now going to bring the shoulders up to our ears. Okay, females tend to hold a lot of tension in the upper shoulders and the upper back. So great one for all of us to be doing in particular, but certainly bring the shoulders up, right up to the ears. Bring your hands and your arms into an L position, bring them into your side, clench your hands into a fist, like you're literally gonna punch something. Sometimes good if you're feeling angry or stressed to visualize that as well. Bring your chin down onto your chest. I have a lot of 21-year-old students say they don't want to scrunch their face up for wrinkles, but I'm sure, you know, make the judgment call yourself on that. Scrunch your face up, bring your chin down, so holding it all tight, over exaggerate that tension. So really bring those arms up, bring those hands into fists, really tighten it up. Hold it for 5. 1, 2, 3, 4, 5, and relax and just shake that out. Now we've done one wave of that. With students, what I'd be doing, and with staff, if you're feeling very heightened and in that kind of panic attack type moment, I'd be wanting to do at least 15 waves of that on the body, okay? And it brings the whole body down, it calms you down, it burns the adrenaline out of the system. I say to staff and students, if you're feeling particularly stressed, do that. You can, you know, sit at a desk and do that. You can sit on a tube or a train and do parts of that and nobody would know what you're doing. At the end of the day, I always think it's nice just to lie on your bed, and you can do that lying down. And the way you do it lying down is you bring your legs out straight and you put your feet into a pointing position and you over exaggerate the tension on the lower part of the body, and you wave up and you hold tight and then you release. You go up and down the body, 5-10 minutes of that. You'll notice yourself yawning, you'll notice yourself relaxing down, and it's a great way of dumping the day and then relaxing into your evening. So that's one way of dealing with that over exaggerated adrenaline rush within the body, the panic. The other thing to try out with yourself, if you're feeling particularly hypo-aroused, so in terms of feeling really tired, demotivated, lethargic, a low mood or a depression, that's more a hypo-aroused state, I'd be saying you need to work on your breath in. So with a hypervigilance or a hyperarousal, we're trying to breathe out as we're doing that exaggerated tension, like a okay. And with a hyperarousal, we're taking the breath in to re-energize and to kind of bring the body up to an optimum arousal. So what I'd be saying is do nice deep breaths in. There's a great technique called the 7-11 technique, which is breathing in through the nose and breathing out slowly for the count of 7. And it's something you can just practice at home if you need to re-energize or re-motivate yourself, or if you're noticing feelings of feeling really low. I'd be working on that to try and bring yourself up to a kind of optimum arousal state. So we've kind of spoken about the health anxiety, the effects on the body in terms of the stress, looked at kind of loss and cycle of bereavement kind of feelings and thoughts coming up, looking at our changing view of life and our parallel process we'll have with our colleagues and with students. I think what might be useful is, if I can get to it, here we are, is to think about what support is available. So you'll know this, hopefully. If you don't, you know, hopefully this will be useful for you. In terms of staff, we have an EAP provider, which is confidential care, and they offer support and advice for all staff and counselling for staff. That's very separate from the service that I work in, because we're predominantly just concerned about students. But support for our students is our service. And just some new things that are coming up, and you'll be the first ones to hear. This week we have a brand new initiative called the Kind Mind series, which is coming live tomorrow, hopefully, which is going to be has weekly themes. And the first one is supporting ourselves during isolation, and this is focused for students. And there'll be podcasts, there'll be an interview with an expert on there. We've got self-directed apps and support, and it's going to be themed every week, and that's going to be live for students tomorrow. The other thing which is new over the last couple of weeks we're running is an online connect group, which is like a support group. It's not group therapy, but it's just a support group for students, overseas students and UK students. Anybody can sign up for that. And actually, there's me, I'm going through it at some pace. I do apologise. Let me just go back down. This shows my Microsoft Teams incompetence. Let me go back down to here. See if I can bring that up. Sorry, let's go in. There we are. OK, so also for students, we have the mental health advice team, which you as staff can refer any students into if you feel you're concerned about them. And all details are on our web pages. We also have the local GPs, either your GP, if you're worried about yourself, please get in touch with your GP, or reach out to them. For students, the Imperial Health Centre, you can speak to a duty GP there. The Student Hub, departmental support with personal tutors, senior faculty tutors, department heads. The Disability Advisory Service is running a full service at the moment, and the chaplaincy are doing some great stuff around loss and bereavement in terms of support for students. And what I'm going to make available to you is on here, you can click on any of these links, and I've tried to put on some tailored podcasts I thought you might be interested in that I've come across over the last couple of weeks, which I wanted to put on there for you. So there's some amazing podcasts on there to support you in terms of the Department of Medicine, in terms of stuff that's useful over during this period of COVID-19 and what we're dealing with. And I put on there some apps as well. The one that I think is absolutely fantastic, please do look at it, because I've totally been using it almost every day, is the iSleep. It's iSleep Easy, and there are some sleep affirmations, and that would be great for you to use, because it actually helps the unconscious brain as you sleep go into a deeper sleep and help to process the day. So I always think that's a good one to be using. And I've packed on there other useful resources. Every Mind Matters, The Mind. Let's go through. And the Listening Place, Shout, and the Samaritans. So I'm kind of whizzing through that. I want to make sure we've got some time for questions. So Chris, is there any questions from anybody that we have?
So Claire, thank you very much for that. What we'll do is we'll make your slides available on our website so that people can download them and click on the links themselves. Yes. I think at the end we lost the slides, so for those of you who are listening, we'll make those slides available and then you'll have the links, so don't worry about that. If anyone's got any questions, if they can put them on now. I'd just like to ask something. One of the things that we're very worried about on the clinical side of things is the relative quietness of people seeking help. Maybe a reflection of the fact that because people are in the midst of it, they're just kind of coping and maybe burying things down. Do you think that might be the case, or are we in a blitz spirit and people are coping better than we thought because we're all pulling together?
I think it's a combination of both. I had anticipated a huge spike. I have been thinking, is that because they're just burying it down? I had thought that about 3 weeks ago, and if that had been the case, my thinking is that with negative coping strategies then taking hold, a period of 4 to 5 weeks, we would see that coming through the service. That hasn't been the case at the moment. So we are seeing students and staff with issues, but I think at the moment it shows that in terms of Imperial that we are supporting each other and students at the moment in a way that feels supportive and you know, holding and containing. So yeah, that's my view at the moment in terms of where we're at.
Fantastic. Someone here, John, has asked, Can I ask about running? You mentioned running off the adrenaline associated with anxiety. Does it reduce the amount of adrenaline in the body?
Yeah, I mean, the very simple adrenaline absorption exercise I did, which is called gradual relaxation. It's something my colleagues at the Priory use with anxiety disorder patients. The best thing to do is to run on the spot and to do at least 20 minutes. It helps to burn the adrenaline out of the system and bring you down to a kind of a regular, kind of a more optimum kind of aroused state. So yes, if you can run on the spot, or just if you can't do that, just to clench and do 15 to 20 waves of that will help. Absolutely.
Fantastic. Another question here. Do you have any pointers for looking after children's well-being during this crisis? Many staff and students have children to care for. That's something that I particularly noticed, that my daughter, who's 9, is getting very anxious at times, particularly around health of her grandparents mostly.
Yeah. I have got children, even though mine are older. Mine are kind of 19 and 21, but certainly with children and teenage anxiety at the moment, it's all about trying to create safety and create that safe place. So certainly with younger children, I would be making sure as much as possible you can keep in touch with via Skype, Zoom, whatever, WhatsApp, video calls with the people, with loved ones, so they can at least see them, because that sense of a kind of immediacy is really important. And then as a parent, and with ourselves, to try and ground ourselves in our safe place. What works really, really well with children is, especially when they're going to sleep at night, is to get them to do the relaxation. They can do the scrunching and the clenching exercise, and then to kind of close their eyes or to keep their eyes open and to say, what's a safe place for you? Where feels safe? Is it here with me, with mummy, with daddy, with whoever? And to try and get them to see what that feels like, to feel that warmth, to hear that affirmation. For some people, it's going to a beach or going to a playground or go to somewhere they went on holiday, and get them to try and bring that to life within their mind's eye. And you take 15 to 20 minutes about doing that, and it calms the body down. And then every day, or every time this comes up as a kind of spike with one of your children, you can say, let's go back to your safe place. Let's go there together. The Tibetan monks do it. They call it astral planing. It's been done for hundreds and hundreds of years, and it's very, very powerful because the unconscious brain gets tricked into thinking they're actually there. So it promotes flood of kind of well-being within the body. So very, very powerful, good to do. Try it out.
Just go to Molly's question first because it's linked. Is it just running, or would any exercise do? So any
cardio exercise. Any exercise, cardio in particular, is the best, but any exercise promotes, as Gary and she'll come on to, promotes well-being and gives the endorphin kind of rush and burns the adrenaline out. But cardio, for sure. So
one here, do you have any advice for those who are struggling to sleep during lockdown?
Yeah, I mean, goodness, my heart goes out to you, because I think this is the number one thing, is sleep disturbance. There's the London Sleep School is a great website to go on to. They're doing great groundbreaking research at the moment with sleep. I think the thing is, get a sleep routine, just like babies and young children have a sleep routine. As adults, we need a sleep routine. And if you can have, as strange as it seems, a shower before bedtime, the core body temperature within 40 to 50 minutes then drops, and it induces a sleepiness. Cut out kind of, watching movies, being on your laptop, all the kind of stuff we know to be true before bedtime. Warm milky drinks, obviously, but if not, I'd be putting the sleep app on. I'd be putting the I Sleep Easy on. I'd be clicking onto sleep affirmations. I'd be getting that voice that talks to the unconscious brain that actually will help process the day and kind of calm any anxiety that's there. And it takes 2 weeks to break a really unhealthy sleep cycle. So if you've turned nocturnal, give yourself 2 weeks, try it for 2 weeks and see what happens. Yeah,
that's fantastic. The next 2 questions I'm going to link together a little bit. How can we cope better with the feeling of not doing enough? There's a pressure to take advantage of this time and complete projects, but that's just sometimes isn't possible. And then linked to that, Do you have any advice for dealing with a sense of fearfulness where, you know, the pressure is coming from work? Because I think there's a big discrepancy between what people are able to do at home. Some people are being very productive, and some people, due to childcare, due to other duties, are finding it very difficult.
Yeah, goodness, both very, very good questions. I think the thing is, you know, as strange as it might sound, be kind to yourself. I think it's all about being kind to ourselves at the moment. To notice that if, you know, I said catch yourself in the act, to notice your awareness, what thoughts are going through. If you're being more punitive, more self-critical, saying that you're not doing enough, if you listen to that too much, you're only going to get yourself caught into a cycle of real punitive thoughts, and you're going to burn out. That's not going to serve you or anybody else well. Listen, we're all in the same boat in terms of some people might be seemingly doing better than others, but, you know, we don't see people behind closed doors. We don't actually see the actual reality. We're only seeing one version or one side of them. So, you know, the reality is we're all struggling with this in different ways. Please remember that, be kind. And when we start to kind of be more compassionate with ourselves and taking a breath, we start to do better anyway. So that kind of self-love, self-compassion, thinking, you know, just achieve one thing today. You know, if you get up, you have a shower and you eat well, that's great. So
I think that's a great point. That there's a trend at the moment for sort of Facebook and Instagram mums and dads posting that by lunchtime they've done a museum tour, baked some bread and done a beautiful craft project, and you kind of feel that, you know, I gave my children milk that wasn't off, so I'm a winner. So I think that's a good point. There's two more questions. We'll try and get through these. Thank you for everyone putting in the question. Linked to that, you know, do you have any advice for those who are spending a large amounts of time at home with their partner and the tensions that come from being around each other and not having space, you know, particularly when you're trying to restrict yourself to the 1 hour of exercise a day, etc.?
Yeah, goodness. I have some empathy with that as well. I'm sure the whole of the UK and the world does. I think it's really healthy to try as much as possible, even if you're in a bed sit, you know, in a one studio apartment room, to create space from each other, and to do your own stuff during the day, and to come back together. So I think it's really important to be able to walk into a different room and create and have time out and have your own space, and to be explicit about that, because you're a better partner to be with if you can do that. So, you know, whatever you could do, exercise together, but exercise separate, or go into a separate room, or have just time and say explicitly, I'm going to have the next 2 hours, I'm going to do X, Y, and Z for myself. And that's okay, because you need to do that. Otherwise, it heightens emotions, it heightens our responses. More arguments, more falling out, you know, more tension. So try and create and carve out that space for you is really important.
I just want to do this one last question, because this is something that we're hearing a lot in surgery and cancer, and it's something I'm very anxious about. Do you have any tips for those feeling anxious about going back to work, and the fact that at the moment we're in this kind of disaster phase, and we can kind of just focus on what we have to do, but then we're going to be simultaneously starting to do lots of things at once as we come out of lockdown, and trying to get everything going at the same time? And is there any strategies you can think to help with being overwhelmed by this workload we'll face as we come out the other side?
Yeah, really good point. I just was talking about it with one of my team just before I came onto this this webinar, and I was saying to them, you know, we need to manage our own expectations for ourselves. So in terms of Imperial coming back to work, we'll be on a phased return, but I think we need to phase our own personal return into life, back into what we knew before we came into this kind of remote working. And we need to be checking in with ourselves and saying to ourselves, what do I think is doable and possible for me? And to be able to write that down, and to think about that, and to think about how we want to do the phased return. So what's manageable? And it's not a case of coming off quarantine, going straight back into everything we knew to be true, right in that fast lane. Personally, that's a recipe for disaster. That will within 2 months lead to burnout, or huge stress or huge depression. So we need to be reasonable and logical with ourselves, and to rethink about what this has taught us. Has it taught us anything healthy? Do we need to readdress any of our goals for ourselves, and to think about that? So I think we need to be thinking about that before we're almost talking to our manager or we're talking to Imperial. So it's having that kind of goal and that list for ourselves. Yeah, and to
That's
do
fantastic. Brilliant. Thank you, Claire.